welcome to the Happy Horse Nutrition Podcast. You are with Dr. Nerida, and today I'm joined by Dr. Luke Wells-Smith, who is dual qualified as both an equine veterinarian and a farrier, which gives him this brilliant perspective on what's happening both inside and outside a horse's hoof. Luke spends a lot of his time working with laminitis cases, and in this episode we talk about how laminitis develops, the early warning signs horse owners should be watching for, insulin dysregulation, nutrition, and why misleading feed labelling can make managing these horses so much harder. It's a fun conversation, and with Luke's unique perspective, there's plenty to learn along with some practical use them today tips. So let's get into it. Dr. Luke Wells-Smith, welcome to the Happy Horse Nutrition Podcast.
Thanks for having me, Nerida. I've been really excited about doing this. We've spoken about it a little bit over the last 6 months, and yeah, it's finally come together and it's awesome.
Yeah, it's great. I said to my partner Ryan this morning, I love talking to Luke, so I've been excited to have you essentially to myself for the next hour or so to ask you a bunch of questions, mainly around laminitis, but I want to start back at the beginning for you. So you're one of these cool humans who has a double professional life, essentially. So you started shoeing horses, I believe, at the age of 15, and then you also became a vet. So I'd love to know, what can a farrier see that a vet might miss with a horse's hooves, and what might a vet see that a farrier might miss?
Yeah, I think that's a really good question because it comes from two different places, I suppose. And one of my friends at Rood and Riddle Equine Hospital in the US, Raoul Brass, I remember talking to him about it and watching one of his lectures, and he sums it up pretty well, I think. A farrier is taught to look at the hoof from the outside in, whereas a vet is taught to look at the hoof from the inside out. And so you've got these two sort of different perspectives that have kind of got to come together because both is important. The external hoof capsule gives us so many clues as to what's going on, whether that's in the healthy horse's hoof or the laminitic horse or the sport horse with a mismatched hoof conformation. The external hoof capsule gives us so many clues. But similarly, sometimes those clues are a little bit off, or potentially it doesn't quite map with exactly what's going on with the horse. And so that's when, learning to understand the internal anatomy and to look from the inside out is also important. And obviously with the advent of digital x-ray machines and that being widely used now and being very easy to come across, we can start to understand, what's really going on inside the hoof capsule. And so, yeah, I think it's about bringing those two perspectives together. And, we're both professions are kind of taught differently as well. Vets are very much focused on, particularly the bones and any pathology within the hoof capsule, for example. Do they have arthritis of the coffin joint? What does the navicular bone look like? What does the pedal bone look like? Whereas the farriers are taught to go, okay, well, let's look at the external hoof capsule. Does it have a long heel? Does it have a stretched white line? Does it have a flat or a bulging sole appearance? Like all of these things. And, once you x-ray them, we can both get a bit of an understanding of where we're all kind of coming from. But yeah, I think for me, it's like, if I look back over my vet schooling, for example, and how I was taught to read x-rays at vet school was very much like, what does this horse have arthritis? Does this horse have, pedal bone damage? Does it have navicular disease? But then if I think about all the farriers that I've worked with over the years and how they kind of understand it, well, it's more about, what's the heel length like? What's the sole depth physically look like? What's the sole contour like? What's the hoof angle? So I suppose it's more of the biomechanic side for the farrier and the living hoof tissue, and then for the vet, a lot of times it's the soft tissue structures internally and the bones and things like that. So that's kind of the way that I look at it. But once you have both perspectives of both sides of the coin, well, then all of a sudden you can really put those two ideas together and come up with a real plan for the horse. And certainly a lot of things, particularly with laminitis, we really are looking at the hoof capsule on x-ray, yes, relative to the bone, but if you disregard a few really important things on a hoof x-ray with the laminitic horse, particularly in the early stages of them developing laminitis, it can be a really tough lesson to learn later on.
Mm. So it's like the ultimate form of pattern recognition, really, for having both, because so much of what we do with horses is pattern recognition. You know, you start to go, I've seen this before, like this is this, but being able to put those two professions together, you can see both the external patterns and the internal patterns and put them together.
Yeah, for sure. And it's, like people think because I'm a vet, I must just like x-ray every single horse. No, we don't do that. And yeah, well, might be great to be able to do that on every single horse, but ultimately budget and even time constraints make it difficult to x-ray every single horse every time you shoe them. But once you do, trim and shoe horses, particularly with x-ray guidance a number of times, you then do start to understand, okay, well, if I see this particular conformation, if I see this deviation of hoof wall, if I see this distance from the coronary band to the ground surface, well, then I can start, and then I x-ray it, then I go, oh, well, I can start to understand and see, when just looking at a horse physically, I can start to get a bit of an understanding of which way they're going to go.
Yeah, it's such a superpower. I love your combination of professions. So what was it that made you choose that path of farrier and vet?
I think
Apart from insanity, I have to say.
yeah, like yeah, sort of it is. I don't know, like I don't do this, but I have tried it, and I think like I sort of liken chewing horses to chewing tobacco. Like the first time you do it, you just feel extremely sick, and you think, why would anyone kind of want to do this? Like it's so painful and physically difficult, and you bleed all the time, and you're always hitting your hands, but it is very addictive. Like when you see a horse come in, and one of the things that you do start to realize as you get older is you can't fix them in the first shoeing, for example. You have to live with some degree of hoof capsule distortion. You can't polish them up and make them look pretty, but in the first instance, but if you're patient and persistent enough, you can, create situations where these horses not only physically are better, but, their hooves look a lot better as well. And that ability to be able to do that is really addictive. But in the beginning, it's a huge learning curve, and I've been really, I think, lucky to have really good mentors. I've always sought out a lot of different people from not just in here in Australia but overseas, but work closely with some people that really sort of guided me in the right direction. I suppose where it all kind of started was my grandfather had trail riding horses, and he sort of got me into horses. And as he got older, he said, well, one of the things that you need to do is to start shoeing my horses so you can come here and ride them with me. So that's where it all kind of started.
Oh, wow.
And then he hooked me up with a friend of his who was, a farrier and a teacher, and kind of started from there, and then just did more and more, and then got into vet school. And I suppose the whole reason for going to vet school is, I like challenges. I like solving problems. I really like first principle thinking a lot of times and trying to solve things for people, and also being outside. Like I didn't want to be stuck in the office all day. I wanted to be out doing things with my hands. And so this ultimately was the ultimate career for me, to be able to do all those types of things.
Yeah, well, so much gratitude to your grandfather then for insisting.
Oh, for sure.
He shoes your horses, because
sure.
The horse was very much better off for having you in it and doing what you do, Luke. So you graduated vet school in 2010.
Yes.
Looking back over that 16 years since then, what has changed most profoundly in your understanding and management of laminitis? Because lots has happened scientifically in that time, but
oh, for sure. Like I still remember, some of the lectures that we had on laminitis, and in particular equine metabolic syndrome, which, we call the insulin dysregulation, or, whatever you want to call it. But I still remember those conversations and those lectures. And it was almost like it was this new disease. It was like EMS is this new thing that no one's ever really heard about. It's sort of these fat ponies, but and we think that it's kind of linked to laminitis, but no one was like kind of sure for certain that's what was really going on. We just kind of had this suspicion. Obviously, we knew at that point about equine Cushing's disease, quite well established. We obviously had, pergolide as a treatment for it, but equine metabolic syndrome in particular just seemed like this, it was just this new thing, and
Mm-hmm.
which is not like we can probably even, sort of understand that even prehistoric horses probably had some form of insulin dysregulation. The fossil record shows that prehistoric horses had, lamella changes and changes to the tips of their pedal bone and were suffering from laminitis, well before cavemen. So
Yeah,
I
wow.
think, the fact that we were 15, 16 years ago, only kind of like, oh, maybe this is a thing. And really it's like a huge problem, and it's kind of everywhere. I think actually we're probably seeing we probably saw, in the last 10 years, we saw a spike. It got really bad. And
Mm.
I think we're actually on the other side of that now. I think we're starting to see, because of all the education that's been coming out and people talking about it more and some new diagnostics, I think we're actually on the other side where I think it's going to become more prevention than it is a cure. And I think we're going to start to see a big change.
Mm. I'm happy to hear you say that because you're right. Like I still remember being at conferences when the original research where they were infusing the horses with the insulin and essentially making their feet fall off, and realizing that insulin had something to do with laminitis, because prior to that it was acidosis, or it was past to laminitis, but we didn't really understand. But I'm very happy to hear you say that you feel like we're getting to the point where there's enough understanding and enough awareness in the equine community that you're seeing it drop off. I mean, it's still prevalent for sure, but
Yeah.
the fact that a lot of horse people with laminitic horses these days, if you said to them non-structural carbohydrate, a lot of them would know what we're talking about now, whereas 10, 15 years ago, I mean, even we as professionals didn't really have a good handle on what that was. So
Yeah.
good. I'm really happy to hear that, and I hope you're right. So this sort of feeds nicely into the next question: is that laminitis is a spectrum. So this awareness, like if horse owners do have an awareness of what it looks like in the really early stages, then they've got a chance of doing something to prevent it. So what does that very early, I would call it subclinical laminitis, I don't know whether that's the right terminology, but what does it look like before we see the classic laminitis, before they get to the point where they're standing out in their paddock rocked back on their hind legs trying to take the weight off their front legs?
I think there's really three phases of laminitis. One you've alluded to, the first phase, which is the subclinical phase. Second is the acute phase, and then final is the chronic phase. And we can probably debate when each one of those starts and finishes. But ultimately, the subclinical phase, there is no clinical sign at that point in time. They're not shifting weight. They don't have an increased pulse. They're not laying down. They're not reluctant to move. Not really lame. In the subclinical phase, I like to describe it as when they're being exposed to a risk factor for developing laminitis. And there's three risk categories that I talk about. One, which is what most of this podcast is going to be about, is metabolic associated laminitis, accounts for potentially up to 90% of all laminitic cases.
Mm-hmm.
The second risk category is what we term sepsis associated. So that might be a horse with has developed diarrhea. It might be a mare post-foaling that's retained their membrane. They've just got some form of septic focus. And a lot of times we'll see these within the hospital setting, not necessarily out in the field, but horse gets sick, goes to hospital, and then develops laminitis secondary to that. And then the final risk factor is this support limb laminitis. So, the horses fractured its leg, for example, it's gone to the hospital, we've repaired it, and it's, overloading the other limb, and they develop support limb laminitis.
Mm-hmm.
And so they're the sort of three risk categories. And in any particular case, they may have one, two, or three risk categories all going at one time. And depending on how many risk categories you've got going on sometimes is a bit of a predictor of how kind of bad they are. So in the subclinical phase, your horse is just being exposed to, a risk factor. And so that, if we talk about the metabolic pony, for example, that might be we're coming through winter, the grass is starting to grow as we come into spring, the day's starting to warm up. That pony is being exposed to a lot more non-structural carbohydrates, and its blood insulin is starting to increase as a response to that. And over potentially a couple of weeks or a month, depending on what that horse's insulin sensitivity naturally is like, that's when we start to, increase our risk of developing into the acute phase. And so once we hit the acute phase, that's basically as soon as we can see any sort of clinical signs. So weight shifting, increased digital pulse, reluctant to pick up one leg over the other, laying down, lame. At the lameness spectrum is pretty big, from doesn't want to get up, obviously very severe, to might just be slightly lame on the turn on the hard circle. Maybe it's a little bit scratchy at the trot while it's getting around. So not necessarily always like that laminitic pony that you kind of imagine. And then depending on who you talk to, and, I think in real life, in day-to-day life, this is not necessarily as easy as we kind of think, because some horses have had chronic laminitis for a long time and they have an acute episode on top of that. But basically the textbook says if you've been having laminitic signs for 72 hours and after 72 hours, you're already in the chronic phase.
Yeah, right.
And chronic phase, depending on the case and the severity of the risk factor, and the number of risk factors that horse has been sort of subjected to, will determine almost like the severity and how long the chronic phase can go on for. I've seen horses that have had a septic focus, have developed laminitis, clinical signs in hospital, and we think that horse is going to be in a lot of trouble. 2 weeks in hospital, it goes home, never shows any changes, is completely fine. You know what? Other horses develop a septic focus, develop laminitis, and then we might be putting them down 72 hours later. So you don't kind of know sometimes in those cases which way they're going to go. With the metabolic cases, they're a lot more predictable. We know research now is coming out about if your horse has a high insulin for extended periods of time, it just significantly increases the chances that they will develop laminitis in the future. And so, the longer that they have a high insulin for, the more likely they are going to have an acute episode, and then they're going to tip into a chronic episode after that. So the clinical signs then kind of change. Like once you hit chronic phase, the hoof capsule signs within the acute phase are almost zero. Like you won't, if the horse has never had laminitis before, that hoof capsule will look pretty healthy, pretty normal, different again if the horse has had chronic laminitis in the past and they have an acute episode. But then once they move into the chronic phase, the hoof capsule changes based on a lot of different factors, but a lot of it comes down to the ultimate conformation of the horse and how that horse's foot started. If it had a very healthy hoof to begin with and doesn't have much of a mismatched foot conformation, and we get onto it early, might not see a lot of change. But ponies typically have upright hoof conformation, so they'll start to get tearing of the lamellar attachment around the toe. They'll have an increase in heel height. You'll see the deviation at the wall at the toe, where you'll see a sharp new growth ring forming, and then the whole lamellar wedge kind of skis out in front. And chronic cases, that's the sort of hoof changes that we start to see.
The way you just described it then as being, we go from subclinical to acute to chronic, and it's such a short time frame between acute, symptoms starting to appear and chronic. But I think the positive thing that I hear in that is that you can stop it at any point along that journey.
Yes.
It's not a disease like a virus. You catch the virus, you sort of can't just step in and go, no, you stop there and go back to being healthy again. But this is not a disease like that. Like if we intervene in the right way at the right time, you can literally just stop it. Like you might dip into that acute phase for 24 hours, but then if horse owners are onto it fast enough, that's as far as it goes. So it's not
Exactly.
I think we sort of talk about laminitis as something that is going to happen to horses, and if it happens, then they're in a lot of trouble and potentially are going to be put down. But it's actually not. It's a condition that horses can dip into and dip out of. And I think the way you described it just then just made me go, oh, like it really is something that we can stop at any point in time. Well, maybe
And the
not.
key is ultimately identifying the risk factor that caused it.
Mm-hmm.
Most of the time, that's pretty easy, especially if we're talking about a metabolic associated case. You do get the oddball cases, maybe like a sepsis associated case that never developed diarrhea, for example, but it had, some sort of significant change in its microbiome for a period of time. Like some of those are a little bit like, oh, why does this horse develop laminitis? Insulin's normal, things seem pretty healthy, but it's clearly got laminitis. But identifying that risk factor, particularly in the metabolic associated cases, is ultimately the key to recovery. So, like if you've got a laminitic pony if you've got a pony that's being maintained out on pasture and they develop laminitis for the first time, you can help those horses out significantly.
Mm-hmm.
If your pony's 25 years old and had laminitis every year for the last 10 years, those horses are much more difficult to turn off again. They're kind of very persistent. We can help them. That usually means that they stay on restricted diet, medication lifelong. So we can help them. We can't, they're not a complete basket case, but once they've been tipped into insulin dysregulation for many, many years, it's much more difficult to kind of turn that back off. If your pony's 6 years old, it's, you moved it from, I don't know, Western New South Wales, and now you're living in Victoria on, previously improved cattle pasture, and you don't realize that spring the ryegrass is through the roof and the non-structural carbs are significant, and that horse develops laminitis for the first time, then we can really switch that off and really help that pony out sort of longer term for sure.
Because there's certainly the experience with my horses. So I have, I'm going to say 2 horses that would definitely be metabolic, the classic crested neck, and they get overweight very easily in springtime. Like even with me doing what I do as a profession and controlling them, the spring grass is just so high in energy. They put on weight really quickly. But and they've both had laminitis in the past, so they would have gone through subclinical stage into acute phase where I can feel either just a pulse or they'll be just starting to get lame at the walk. But luckily, because I do keep a pretty close eye on them, like you can stop it, and they both are barefoot horses. They've got good feet. You can't go galloping them up gravelly roads or anything, but that's probably pretty normal for any horse's foot. But it is that if you catch it early enough, you can prevent disaster. What are the things we can teach horse owners? Like, what would you teach horse owners as monitoring tools for these horses that we know are risky? We know that we've got this cresty, necked, overweight, metabolic pony or horse. What should we be looking for?
I think particularly if we're talking about metabolic or insulin dysregulation, for me, the first sign before they even develop any sort of signs of inflammation, true signs of inflammation, true, lameness or anything like that, is looking at the fat pads above the eyes. So what we call the supraorbital fossa. If you have a pony that goes from having a dip above the eye, and you can have a look and you can stick your finger in there just above the eye and press in there and see if there's any fat sitting there. If you notice that those areas are starting to develop bubbles, that fossa or that hollow is starting to fill up with fat ultimately, that I feel like is one of the best predictors for working out whether my horse is about to tip into an insulin dysregulated state. My thought is that the horse is probably already has a high insulin, probably already is dysregulated naturally, because we also need to remember that insulin dysregulation as a disease is also at some point quite protective if you were living in the wild.
Yeah, this is
Your
true.
ability to eat green grass and convert that and store it as fat is going to help you later on. The problem is that these horses are always in contact with high non-structural carbohydrate feed, hay, pasture, hard feed. So they're just constantly storing fat and being in an insulin dysregulated state. So for me, my first thing to look at, and if you got a horse that you suspect, and this is a very timely period to be talking about this, because if your horse is a little bit dysregulated now, come spring, it's going to be really dysregulated. Have a look above the eye. If you start to notice that they're starting to fill up with a bit of fat, that's one of the first indicators. I find the cresty neck a little bit difficult to be really consistent with, because I think, feeling it is kind of hard. Like, obviously, like the no-brainer ones that are, body condition score 8 out of 9, like Ray Charles could see those guys are probably overweight and going to have laminitis. But different breeds will also have different regional adiposities. You look at some of these, gypsy cobs, for example, that do store a reasonable amount of fat around that area, compared to a warm blood, for example, with a thinner looking neck. I think it's just a little bit more tricky to kind of work that out. Identifying regional adiposities or fat pads and not mistaking them for muscle is probably one of the biggest things. So these fat pads happen first above the eye, like we've sort of discussed, like you spoke about, over the neck is important. The third place that a lot of people miss is actually behind the shoulder blade. Some people think, oh, my horse is starting to build up muscle there. No, that's actually a fat pad.
Yeah.
And then the final place that there's one more place after that, but the final place that we see in a lot of horses is obviously over the rump. We'll start to see some fat pads around the tail head. And then finally, in geldings and stallions, they'll get some fat around their sheath. So sometimes you get called and someone says, oh, my horse has got a fat sheath and, got to have been bitten by something. No, actually, it's just a bunch of fat there.
Just a fat sheath.
Yeah. So they're the sort of things that we kind of look at more longer term. And obviously, when you're looking at your horse every single day, sometimes it is a little bit difficult to kind of map this stuff out. And obviously, coming out of winter, taking the rugs off regularly, making sure that their body condition's looking pretty good. That's all important from that perspective. So for me, if I'm trying to understand, does my horse have underlying insulin dysregulation, they're the sort of things that I'm looking at. And then the hoof stuff and the lameness kind of comes a little bit later, like if I look back over the history of a lot of these horses that I've dealt with over the years, it's kind of like, they started to stack on a little bit of weight. Maybe they had like some sort of, lameness or some sort of behavioral issue. Then the horse has a little bit of time off, which is ultimately one of the worst things that you can do for a horse that's insulin dysregulated, because as soon as you stop exercising them, becomes a bit of a vicious circle. You stop exercising, your insulin becomes more dysregulated. And this is the cycle of laminitis. And obviously in the wild, if you develop laminitis and you're not moving around and your insulin gets higher and higher and higher, yes, the wolf is going to catch you, because you're going to be, or the lion or whatever is going to be around the corner, and you're not going to be getting anywhere. So same thing happens here. We stop exercising our horse because of some vague reason, which is sometimes the early signs of laminitis. We think, we can't ride, we can't exercise. We still continue to feed the same feed. We don't drop the feed back. They're still potentially on pasture that's high in non-structural carbohydrates. And all of a sudden we get this real cycle of increase in insulin and becoming more dysregulated.
Yeah, the exercise is definitely very, very protective. I say that with our popcorn. She was Tamaya's competition horse, and now she's not. And she this year moved her into a pasture. It was all dead dry pasture, but within a week she was a bit scratchy when someone was riding. I'm like, oh, something's not right. And then she had an alternating pulse. It was sometimes there, it sometimes wasn't. But if we can keep them in work, it is amazingly protective. But the fat pads is really interesting, and I literally want to leave you here by yourself and go out and and look at my two
Have a look.
horses because yeah, it's not like I mean, I'm aware of it more from a Cushing's disease perspective, but that's not something that I have really paid attention to. So I will definitely be paying attention to my two with their fat pads over their eyes. Quick pause. You know what costs horse owners the most? It's not buying the wrong supplement. It's spending years second-guessing yourself, Googling at midnight and wondering if you're getting it wrong. That's the thing I built My Happy Horse to fix. It helps you create clear, personalised nutrition plans for your horse based on actual science so you can stop doubting and start trusting yourself again. Find it at myhappy.horse or on the App Store. Okay, back to it. Digital pulse, talk to me about that. Where does that come in?
Yeah, look, if we've developed, I sort of think about a digital pulse as, we're kind of trying to understand how a horse kind of feels, which, is sometimes dangerous. But, ultimately, a digital pulse is what I would think it would be like if you jammed your thumb in a door and you create an inflammation under your nail bed. It's almost like a compartmental syndrome, like you've got this hard hoof wall, this hard bone, and then you've got this soft lamellar attachment that has nerve endings and blood vessels. And when that swells, that becomes painful, and we start to feel that sort of throbbing pulse, I suppose.
Mm-hmm.
And I suppose the textbook definition of an increased digital pulse, yes, it could potentially be an increase in heart rate, but I don't find that to be hugely predictive unless we're more talking about a horse that's towards the end stage. It's quite a severe case, might have them in hospital. We're monitoring their heart rate twice a day, and we're trying to work out, where's this horse kind of going and how is it coping with having some severe laminitis. In the horse that's out in the paddock, increases in heart rate, I think, is much more difficult to kind of look at. So then what we're trying to determine is an increase in intensity. And so that becomes quite difficult if you get into the nitty-gritty of it. But actually, if you're a horse owner, if you can feel a digital pulse in one or more limbs, that means that you may be having a laminitic episode. So in general, a horse that doesn't have laminitis, it's very difficult to feel that digital pulse. But if you feel a pulse in one or more limbs, that's more likely to be a laminitic episode.
Mm-hmm.
There are cases where we do just get a digital pulse in one limb in a laminitic horse. It's usually in a horse with a mismatched foot conformation, one flat foot, one upright foot. The upright foot will tend to have an increase in digital pulse because the foot is under different biomechanical strain.
Mm-hmm.
But the general rule for a horse owner, if you can feel it in one or more feet or limbs, that's how we kind of know that the horse has got, having a bit of a laminitic episode. And don't get too worried about that, one's a little bit more intense than the other, or one side of the limb is more than the other. Like, I think all of that stuff is probably, not really in the realms of being overly important clinically. But like I said, if you can feel it in one or more limbs, if the horse is, while you're checking the pulse, the horse is shifting weight frequently. So horses typically will shift weight if they're standing in a stable or standing still. They do shift weight throughout the day. But if they're doing it like every 30 seconds, they're moving from one leg to the next, that's a really indicator that the horse is having some sort of inflammatory situation going on.
It's a lot more obvious too when they shift weight because they are literally kind of just rocking from one side to the other, like we do when we're dressed up and in high heels.
Not that I've experienced that, but yeah.
My feet, no, I wasn't dragging you into that one, Luke, but my feet are really sore and I need to shift weight. So to take a digital pulse, though, it's a very can you talk me through like you would telling me how to do it if I'm in the paddock with one of my horses and I'm on the phone to you going, I'm not sure if this horse has got a digital pulse. Talk me through that.
So basically the place to check them is what we describe as over the neurovascular bundle. So basically where the vein, the artery and nerve all run down the sort of back side of the fetlock. Now, the vein, artery, and nerve run on both sides of the leg, so the inside and the outside. I think the best way to kind of find it, obviously, technically, it's a little bit, for me personally, it's a little bit easier to find the inside one because I kind of wrap my fingers around the inside of the limb.
Hmm.
But basically, when you do that, so say we're looking at the near side front, I will be facing the back side of the horse with the horse's head, over my back, over my shoulder. I'll run my hand down the inside of the leg and I'll run down till I'm at the sort of level of the fetlock. And then the best way to kind of find that neurovascular bundle is to run your fingers sort of horizontally across the leg, really lightly. Eventually, you will feel these little threads underneath your finger. And those tiny little threads, that's the vein, artery, and nerve. And that's where you'll find the digital pulse. Now, it's important not to press really hard on that area because you will occlude it. You won't be able to feel the pulse itself. So you do need to be quite light when you're feeling it. And I'll do that, with my two fingers on the inside. And I still use my thumb on the outside. Some people think, oh, well, you can't use your thumb because, your thumb has a pulse, blah, blah, blah. But ultimately, if the horse has got a significant digital pulse, I'm going to feel it with both fingers without too much of a drama.
Yeah, okay, because I had also heard that don't use your thumb. And I find sometimes I have to hold my breath when I do it
Yeah.
because otherwise if I'm moving, I'm like, oh, is that a pulse? Can I feel something? But I think when you can feel something, you can feel it like it is there. Like,
It's real.
yeah,
Yeah.
yeah, it is there. And I think probably the thing to do, and I'm sure you'll agree with this, but the thing to do if you've got a horse that you're worried about, just feel their pulse every day.
Yes.
And then you'll
Yeah.
get a
I think
sense for when they're changing or if they change.
And I think one tip that's really important, particularly if there are young veterinarians or farriers that are listening to this, is you can only check a digital pulse while the horse is fully weight bearing on the limb. So if you run your hands down the horse's leg and it picks the foot up, you cannot feel the pulse. So sometimes you have to trick it. Sometimes you have to stand on the opposite side of the horse and feel the leg that's on the so if I'm doing the left front or the near side, I'll stand on the off side and I'll run my hand down, usually the offside front first, and they'll pick it up. And then I'll just quickly go ahead and I'll run my hand down the near side front from the opposite side. Just obviously be careful that you don't kind of get your arms, kind of twisted up with the horse's legs, but obviously you just tack it on the other side and that'll kind of trick them a little bit and they won't lift it up. It's particularly important on hind limbs. A lot of horses, when you run your hand down, they'll just automatically rest it. You can't feel a digital pulse on a horse that's resting their foot.
Okay, that's a good tip. My horses are obviously not well enough trained to worry about picking their feet up every time. I think they're so used to be checking their digital pulse that they don't bother. So just really quickly, talk to me about rings on the hooves. Like, when are they indicative of something that either has already gone wrong or is going wrong, and when are they just normal fluctuations between, here we go from lush green to burnt dry within the space of a couple of weeks. So their diet, being pasture based, is shifting a lot.
Yes. I think, if we talk about inflammation within the hoof capsule, you get extension of that inflammation to the coronary band. So when we talk about laminitis or even a foot abscess, you get inflammation within the hoof capsule, but it also extends to the coronary band. And now the coronary band is where the hoof tubules essentially grow from. So if you have a period of time where the hoof is inflamed for whatever reason, laminitis, hoof abscess, now we're talking inflammation of the hoof capsule structures, not, the deep digital flexor tendon or the navicular bone or the coffin joint. They don't cause growth rings at all. It's just purely hoof tissue, hoof inflammation. You'll start to see that growth ring start coming down. Now, in laminitis, we term growth rings to be divergent. And so what that essentially means is that there's a growth ring that's narrower at one section and wider at the other. And so the typical case is the laminitic pony that already has a quite upright hoof conformation. And so when they develop laminitis and they go through the acute phase and they head into the chronic phase, the hoof wall at the coronary band at the toe will be slow to grow compared to the growth ring at the heel. And so it does give you a bit of an indicator of where the hoof is growing from. And that's important because if there's hoof growth in a particular region, there's blood supply in a particular region. So a chronic laminitic pony that grows 2 inches of heel over a trimming cycle, if we were to do what we call a venogram, where we use special contrast and take an x-ray of that pony's foot, we'll see a huge amount of blood supply in the heel region, and we won't see that much blood supply to the front of the pedal bone and down from the coronary band at the toe. So growth rings are an indicator of inflammation, but they can also be a bit of an indicator of where the hoof is growing. So that's where it can be quite important.
Yeah, that's fascinating. I love how eyes get opened when things are explained to you. Like
Yeah.
like you hear about divergent rings, but I'd never had it explained that where they're
Yes.
wider, that's where the hoof is growing.
And it happens the opposite on a flat foot. So if you have a horse with laminitis, ultimately how their hoof grows is dictated by their underlying conformation. And so if we have a horse that has a club foot and a flat foot, the club foot will develop that sort of divergent growth rings like we talked about in the laminitic pony. Usually that foot gets a digital pulse first, and that's usually the presenting complaint. Oh, my horse has a unilateral, or say a right forelimb lameness with an upright foot. What's going on? And then once you look at the supraorbital fat pads above the eyes and the regional adiposities, and then pull an insulin and it's through the roof, and we take some x-rays to kind of know what's kind of going on. But in the flat foot, you'll typically get almost like the opposite situation, where you get a lot of growth in the front part of the foot, and the back and the heel region, particularly on the medial or the inside wall, will be quite slow. So yeah, it's a really, this is where that whole, what we talked about in the very first start of this podcast, was about how you can use the external hoof capsule and then map it to the x-rays. This is this perfect example where you can kind of see that happening.
That's fascinating. I will now also be paying a lot more attention to the shape of any rings on any horses that I see. So like there is still, I mean, even with awareness growing about laminitis and what causes it with these insulin dysregulated horses, there is still an awful lot of horses that get laminitis. And one estimate that I read was that 1/3 of horses who do develop laminitis are humanely euthanized within 12 months of being diagnosed, which I think for both of us is a pretty horrifying statistic, because we know full well that a lot of these cases can be prevented but also stopped in the early stages. So from your perspective, as both a farrier and a vet, where is that battle lost most often for those horses? Like, what goes wrong for them? At what point don't we intervene? And I guess the second question is, how much of a role does poorly controlled nutrition have in that?
Yeah, I think, and I think from memory, that study's out of the UK. So, a lot of this is going to be around, metabolic, ponies and cases like that. And so, do we see a similar percentage here? Maybe slightly less, because, Australia's environment is so much different to the UK. Like the UK is probably pretty much like Victoria, a lot of improved pastures, really 4 seasons, not so much summer, but, they're probably living in a very similar type situation. And I think the battle is lost when we don't identify the risk factor. So we'll just bring that back into play. Like, without the understanding around insulin dysregulation and how that affects your horse, you're never going to be able to stop or improve a case. And that's been the biggest game changer within my career, because like I remember, before I became a vet, and then, early in my career, dealing with these horses with insulin dysregulation. You could trim them to x-rays, you could put thousands of dollars worth of therapeutics on their feet, but they were still uncontrolled. They were still insulin dysregulated. And that was, we could put them all on all the diets. We could try and exercise them. We could give them anti-inflammatories. We were literally doing everything for them. We were identifying the risk factor, but we couldn't get the risk factor under control because they were living in this I suppose, situation where they were in this never-ending cycle. We couldn't get them out of pain enough to be able to exercise them. And so I think, early on and that's where I think things had kind of gone wrong over the years, and why that study's so pivotal, because that just shows how we couldn't control that. And now the change has been is that we can control, their insulin dysregulation through medication for a period of time, so that we can start exercising them again, because like you and I have spoken about it before, and we've worked on cases before, like these horses, we can't seem to turn the insulin dysregulation off. And like there's we'll talk a little bit about it, but obviously, the marketing of different hard feeds and what's on the bag and what's in the bag and all the rest of it is another question. But for me, I think it's always gets back to, we needed to identify the reason, why the horses develop laminitis, which I think we've been quite good at over the last 10 years. But in the last 5, things have changed where we can now medicate these horses and bring them back to insulin dysregulation. So it just turns it off for a little bit so we can get all the other stuff working. And I think that's where I'm more optimistic about these cases now, is because we can actually change the trajectory. Like once they've been tipped into insulin dysregulation for a period of time, we can turn that off, get their diet right, get their exercise happening, and flick these things around without, having them crippled for a whole year and just a never-ending cycle, basically.
And from a nutrition perspective, is really important. Like while you're using the medication and getting them through that acute phase and turning the whole cascade of the disease off, essentially, for a little while for them. If those horses then go back onto the same diet, though, that triggered them in the first place, it's just going to start the cycle again. So the nutrition of them becomes so important. And I think I look at laminitis from a similar but also very different perspective to what you do. Just from the direction I'm coming in at it from, and in my experience, if you can't get a horse sound, barring changes in the hoof that you're having, but before a horse actually changes anything within the hoof capsule, if you can't get them back out of that laminitis, there's still something in their diet that's triggering them, and it's a matter of going in there and going, what is it?
Yes.
What is in this diet still that is still setting them off? And this is where, we both share this frustration. I'm going to say intense frustration, because there is, you mentioned it briefly there is a lot of misleading and incorrect labeling on feed products. Like I saw one the other day, massive writing across the front of the bag, grain-free. And then the first 2 ingredients are wheat pollard and wheat bran. Now, if someone in the UK is listening to this, they might go, well, and because their wheat bran is very different to our wheat bran. But in Australia, wheat pollard and wheat bran's like 20 to 25% starch still. So horse owners end up in this situation where they think they're doing everything right for their insulin dysregulated laminitic pony and choosing products that are telling them they're grain-free. And a worst case is when a feed company will say it's grain-free and not put the grain ingredient they're using in that product on the label. It's just hidden in there. So, they end up in this situation where they feel like they're doing everything right, but their horse is getting worse, or at the very least not getting any better. And I know you're someone who, you see this from a much more stark perspective, I guess, because you're the one that's trying to hold their feet together. Is that, like, for the horses that battle laminitis for a long period of time? I can't really say is that something you see, because I know that it is, but just give me your perspective on that issue for horse owners.
It's huge, and I think it's gonna come to a head, and I don't understand why feed companies aren't getting on board with the idea of just being truthful around the labeling. Like, I understand it from a product perspective that there's a marketing element to it, but I've even had this conversation with some of them, and I'm like, why can't you be the leader of this, right? Like, why can't you say, across all of my products, and most of them have too many products, which also is just
Frustrating.
seems insane.
Yep.
But why can't you just come out and be like, okay, I'm gonna give all of the ingredients. I'm gonna create a label that is standardized across my product range, so that when an owner comes to the feed store, they can then go, okay, well, I can compare this bag from my favorite brand, and like I'm already buying their stuff, and I'm going to compare it to another bag of their same thing, and I'm going to go, well, my horse is a 15-year-old Shetland pony. It's a little bit overweight. I'm going to choose this because like horse owners actually understand this stuff now. Like they know what to look for. It's just the companies are literally not putting it on the bag. And like surely at some point this is going to have to come to a head where someone's going to turn around. Some horse that's mega expensive is going to get laminitis, and that owner's going to go, hang on a second, this doesn't make any sense. And I was told here by this company to feed this because it's X, Y, and Z great, but it wasn't, and it was the worst thing for my horse. And with all the data that we're collecting and all the insulins and all the cases, it's going to become to a point where it becomes an issue for these companies, a risk factor to continue operating the way that they are. And I just don't see the reason why they need to do it. It just blows my mind that they're still continuing to do it. And I think, horse owners in Australia need to understand why we're in this kind of state that we're kind of in, because ultimately the performance horse world is so much smaller than the thoroughbred world. And, a lot of these extruded feeds were all made around the thoroughbred industry. How can I feed 200 brood mares with 2 backpackers twice a day? Let's create a product. And it's so innovative. Like, I think some of the things that have been created are amazing, but it's also shaped the way that a lot of feeds have been created in this country, which is not necessarily good for, the other part of the market, I suppose, that we're kind of dealing with. And that's where the welfare of these horses gets a little bit tricky, we're starting to see feeds that are more performance horse or pony kind of base. But again, the labeling is like, you walk into a feed store, and even for me, walking through there and picking up these bags, I'm like, which one are you supposed to recommend? Because ultimately people ask me all the time, and I've got to come up with something. And, I think it's just getting harder and harder. So that's the thing that I would just love to see change, is that someone, like, I know we don't really have like a governing body over, the nutritional labeling in this country for horse feeds, but even if just like one company would make it part of their thing, it's just like, hey, we're going to have open and transparent and consistent labeling across our product range so people can choose what they feel is necessary for their horse, because it's got to get to that stage. And this is the super interesting observation that I have about buying horse feed is it's so hard. And as an owner coming to a feed store, and you walk in there and you already got someone trying to help you find the best feed for your horse. Now, there's lots of things that go into that, like that the person in the store might have had a laminitic pony in the past, or they like this, or maybe the rep for this particular company came in a week ago and said, this is the best thing for your horse. But what I liken it to, it would be like walking into the supermarket and having someone in the supermarket walk up to you and say, hey, maybe you should buy a bag of apples instead of, this or that. They're actually recommending what you should feed your horse. And you can't make that decision. You can't pick up a bag yourself and decide which one's which. And it's just very confusing.
Yeah.
I know.
I mean, it is, and I agree with you on all of those points. And I mean, as part of what I've tried to do through my career is actually give people tools. I built the Equalize software 22 years ago, and then we built Feed Excel, and now we have this My Happy Horse. They're all sort of there to help people put diets together. But I mean, I was so idealistic when I was younger and going, I don't want to influence anyone, and everyone needs to be able to make their own independent choices. We will get this app to the point where they can put all of the details in, and I think that's what you're getting at when you go into a feed store. Like, unless that person who's trying to help you gets a full history of your horse, all of their forages, what their exercise regime is, what their history is, what their genetics is, what their feet may look like, do they have fat pads over their eyes? Unless they know all of that, they can't make a good recommendation. And so we will get this app to the point where once we've got all of that information, it will offer suggestions for feeds. It's not quite there yet, but we will get it to that point. And I think I realised that we needed to do that when I was thinking I had to go and buy. I've got a very old tractor. Luke is like 19, Betty, her name is, and she's from the 1960s. But there's like three different oils in Betty. I don't know which oils to buy for Betty. So if I went to the mechanics or whatever, and they handed me a 15-page brochure and told me to read it and then choose the right oils, I'd be going, can you just tell me? So it's, it's sort of that situation. But the mislabeling I don't understand. I mean, I've worked with a lot of feed companies over the years, and no one has mislabeled a feed on my watch. So if and I was just doing the labeling for a new product that'll come out in the next few months, but there's wheat bran in there because it was needed as a carrier for the premix. It's 4 grams per kilogram, and I will not let them label that grain-free because it's not, it's a tiny amount, but it's got to be on the label, and it's not. But we can label it with the non-structural carbohydrate level, and then that's probably part of the labeling that you're talking about. That's not consistent. We don't have that on all of the labels, so people can't make good choices. And then the big bright print on the front that says grain-free is just so reassuring, I guess, as a horse owner, that you go, oh well, this will be safe. And it kills me. I don't understand how feed companies who are there for the good of horses deliberately put them at risk.
It's unfortunate that I think a lot of, not all companies, but some of them play on the fact that us horse owners want to do the best for our horse. So we read this stuff, and we're easily marketed and manipulated into doing and buying these things because we believe that we're being told that it's the best thing for our horse. Like you need 16 different supplements, and you need to feed 2 different hard feeds, and you must do all this. But I think ultimately people are starting to realize that a lot of that stuff is not real, they're just being marketed to. And as the cost of living goes up, horses aren't getting any cheaper. So people are starting to knock off all of these different things, and they're starting to go back to the basics now, and they're starting to formulate their own feeds and try and work things out for themselves to try and reduce the cost. And they're finding that not only are their horses not getting worse with whatever they thought they were helping for, they're actually getting better, because a lot of people don't realize, this supplement or that supplement, we're trying to chase, a 1% here or 1% there, but we're not actually understanding what we're actually giving the horse. And maybe it might have one good thing in it, but then it's got 5 bad things in it. So what's the point, Which is
where we come in giving them the tool to be able to actually visualize the diet, and you can see that with that one product, you are actually meeting all of your horse's nutrient requirements. But unless you can see, even for me with complicated horses, I don't trust myself to just put a diet together. I still want to go through and actually visualize it all. So just moving on, sugar beet pulp is an interesting one. And it can be very low in non-structural carbohydrate, and it can be a very useful ingredient for a lot of these horses. But I know from an analysis perspective, its non-structural carbohydrate can vary. And I know from speaking to you over the years, you also find that the success or failure with sugar beet pulp is also very varied as well. Is that still the case for you? Do you still have issues with horses on it?
Yeah, I think what I've always found with them, I think I can kind of get away with it on, a performance horse that might be a bit insulin dysregulated, but it's in full work. But anything that's not exercising, and I think you've probably told me this in the past, it can be still so high in calories as well. So I think from that perspective, I don't find it particularly helpful. Like if I've got a laminitic pony, that's not exercising, it's in pain, and it's on beet pulp, they just don't do very well on it. But I think the horse that's in work and competing, but they need a little bit of extra energy, I don't find it to be too bad because they're already on the edge of being regulated anyway, I suppose, from that perspective. I do wonder about it, like maybe its effects on microbiome, because essentially it is like a short chain carbohydrate, right? So I don't know whether that helps with some of the changes that we see in the hindgut around microbiome. I don't know.
Yeah, I mean, it's a
Short chain fatty acid production.
it's a fiber, and it will ferment to volatile fatty acids, not lactic acid though. So that's what you get when you ferment starch. But I mean, it's got enough because it's grown for sugar, right? So depending on how much of that sugar they washed out of it when they processed it, it can still be over 12% non-structural carbohydrate. For anyone listening to this and you're going, what is non-structural carbohydrate? There is a whole episode. I forget the number now, but if you search for it, it'll come up in the Happy Horse Nutrition list of episodes. So you can go back and figure that out. But essentially for a laminitic horse, we want feeds and forages to be less than 10% ideally. Pat Harris, most amazing nutritionist in the world, in my opinion, but she presented some data at the Equine Science Society meeting in Melbourne last year to show that a horse on a 9% non-structural carbohydrate hay still had elevated insulin response. So like, no, Pat, no, we don't want to know this. So there will be, and actually her advice is that when you, and this might be handy for you, Luke, with your work, is when you can't stabilize a horse, give them a meal of their hay that might be tested hay and you think is safe, but give them a meal of their hay and then test their insulin response to see if they're actually still reacting to that level of non-structural carbohydrate, even if it's below that 10% threshold. But yeah, beet pulp, I mean, it's got the same calorie content as oats, so it's not exactly a good diet
weight loss.
It's not a good weight loss feed ingredient, but it is useful. I mean, it's got beautiful fiber, so it does add fiber diversity. I love this stuff, but I am also aware that with laminitic horses, it can be risky. But there's a lot of people that will say, if you soak it and rinse it 3 times, then it's okay, and that is probably true because you're just washing out the extra sugar. But I have never recommended someone do that because it's a lot of time in feed preparation. So if you've got a horse that's laminitic and it is on beet pulp, you can't get it stable, ditch beet pulp for a period of time and just see if that helps. Anything else you want to say on feeds, supplements? I mean, we haven't even talked about forages, and that's a whole other conversation because we have to get them right too. But just on that before we move on, Luke.
I think, we've talked about insulin and the metabolism being a really important component, but I think the thing that we haven't unlocked yet, which is getting closer, is looking at the microbiome of the horse and having tools to really look at that. I partnered with a human lab and we have done some sort of DNA analysis of some horses' manure and it's really like super interesting. It's very on the edge of trying to work out, what's normal, what's not, and trying to sort of sift through all that information because you get a lot at the end of the day. But, we'd all understand that we're feeding our horses to feed the microbiome, and that's what's protective for a lot of the diseases that we see. And, it's whether it's in people or horses, it's all kind of interlinked. And so, like we're sort of talking about this, understanding of short chain fibers and roughage and hard feeds and a lot of the synthetic products that are now going into hard feeds. And what does that do? Like we've got all these synthetic amino acids going into these complete feeds. Like what is their role? How does that work? How are they digested? Is it normal? Is it not? Like a lot of questions are now sort of coming out. And we know in people in particular, ultra processed foods are not really good for you. Like if you're eating ultra processed foods all the time, and they're not just chocolates and chips and ice creams, but they're also, protein bars and supplements and all this other stuff, well, that's having a significant impact on our health. And so, if we're starting to feed our horses ultra processed foods, well, what's that effect, particularly on the microbiome? And, like we're not all astronauts living on some, ultra processed amino acid feed type deal, like we can't live like that for very long. And, I think we need to be careful about what we're feeding our horses and look at what's on the bag and how it's being produced as well. So,
And I think, I mean, the big thing for me as a nutritionist is the closer we can feed them to the way they evolved, the healthier they will be. But I do just want to say here, because it is really important with grains, unless we process them, they're unsafe to feed.
yes, which is something you taught me. Yeah, it's really interesting.
So
Yeah.
so yes, there's it does my head in when I go to the States and they talk about over there, feeding horses complete pelleted rations. That's all they get. I'm like, no, no, let's not do that. Like, that is such an unhealthy thing to do. I mean, mentally unhealthy for them as well as physically unhealthy for them. But from a grain perspective, they have to be processed because otherwise we just dump a whole heap of starch into the hindgut. But you only really are feeding grains to horses that need the energy. So brood mares and high-level performance horses, everyone else we can really get away without having grain, or at least get away without having a significant amount of grain in their diet. And yeah, the microbiome is fascinating, and it would be really, really interesting to have a look at, horses that have tipped into laminitis versus not. There is a company in Australia, and there's a few interviews with Belinda, EquiGI, who will do full microbiome analysis down to species level now. So we've
Oh, that's
got the
cool.
technology.
Yeah.
It's just a matter of then finding the patterns.
Yes.
And then knowing, like, well, how do we then manipulate that pattern? Like, what do we have to feed? What do we have to do? But it's such a big area. It blows my mind, the microbiology stuff, but it's super important. And I think you're right. Like, I think we'll get there sort of over the next 10 years. We'll have a much better understanding, and hopefully be able to help you do your job with getting feet right by changing what's going on in the gut.
And I suppose on microbiome, when we're talking about microbiome, and supplementing it, the products with just, fairly bland brewer's yeast as a probiotic is not the golden, it's not the silver bullet for microbiome. If you look at human, a lot of the products in the human space, the list of products that you can buy as a person to help your microbiome, all the different bacterial species, is astronomical. In the horse world, we are literally using one species and that's it. And so just remember that when we're talking about microbiome and you're thinking, how can we change it? And you start Googling, different things. Like, there's a huge world out there in terms of different species of pre and probiotics out there.
There's not a whole lot. Well, there's no evidence for bacterial probiotics in horses for repopulating microbiome. And honestly, Luke, the best thing people can do is get fiber diversity into the diet. Don't feed one type of hay, feed 7.
Yeah.
That's a lot, but if you can achieve it, amazing. Don't plant 1 or 2 species in your pasture. Plant 15 if you can. Allow horses out onto natural areas to graze, because that's where they'll find the fiber diversity. If you feed poorly and then try to use a supplement to fix what you're doing in the diet, I often use the expression, it's like trying to use a garden hose to put out a bushfire. Like, you're not going to get anywhere.
Nah.
It's just not going to work. So I think from the microbiome's perspective, supplements, I formulate supplements as part of what I do for a living, so there's definitely a role for them. But when you're trying to fix stuff that you are breaking with poor diet in the first place, it doesn't work.
Wow. And like you touched on, diversity of, hays and forages gives diversity of microbiome. That's one thing that we definitely do know when it comes to analysis of the microbiome of the horse and people. The more diverse that you eat and the more diverse your horse eats, the more diverse the microbiome will be. And we believe that that's the important. Yeah.
And I think, and this is going off on a little bit of a tangent, but for laminitic horses, often what happens is people will find one safe tested hay, and then they feed them that hay. So they, you restrict their fiber diversity right down, and we don't know then what that does to their insulin dysregulation. Like there's every chance that that will make their insulin
Mhm.
dysregulation even worse, and
Yes,
they're at higher risk again for future episodes. So it's, I mean, they're tricky from every perspective to manage laminitic horses. I know that because I have a couple of them, but and I've had someone say to me, "Oh, that's ironic. You're a nutritionist and you've got a laminitic horse." Or it doesn't automatically protect you just because you know what to do. You've
that's
still
right.
got pasture fluctuating and hay fluctuating, and they're not easy to manage. So
Oh,
I do want to move on to our clear round quick questions, but
yes.
before we get to that, Luke, how can people find you? Because I know that you've got lots of different ways you can work with people. So how can people find you?
Yeah, so best way to kind of get in contact with us is through our website, motion-equine.com.au. And so that'll give you a pretty decent overview of kind of what we do. We just recently redid our website. And one of the things that I've been doing, well, pretty much for 10 years, is that I have been running like a telehealth service. So for people not in my area or interstate, I basically have now a bit of a portal where people can, submit a form. They can add all their horse details in. They can add the history. They can upload all their x-rays, photos, videos, whatever they want to that platform. And then I can review it all. And basically what we're doing nowadays is recording a video call of me going through the history, going through the x-rays, making a bit of a plan for the horse, and giving people as much information as they kind of can. And people have been really getting on board with that lately. It's sort of streamlined the process, and yeah, it's been really good. Obviously, I live here in Victoria in the Macedon Ranges, so we obviously service people locally to us in Woodend, but I also travel to the Mornings Peninsula every 2 weeks, and I still go to Albury in New South Wales once a month as well. So yeah, catch me in somewhere along the line.
Great. And I will put links to your website and also to the telehealth
Sure.
on the show notes for this podcast. I think the telehealth is such a cool idea, and it's a great way to do it, and it's also very reasonable too. So if anyone is struggling with a horse with laminitis, find Luke. Even I assume if they're overseas, it makes it all very accessible.
Yep.
Okay, are you ready? Clear round, quick questions with no
Sure.
refusals, Luke. What is your all-time favorite horse movie or book?
I had to think about this for a little bit, but as a kid, and like we sort of alluded to, my granddad got me into horses. And so a movie that we used to watch over and over again as kids was called The Cowboys with John Wayne.
Uh,
It's a
I
really
I
a
have
funny movie.
not seen that one, but
Yeah.
did you aspire to be a
Old
cowboy at any point in time?
I still have cowboy boots. So yeah, I did want to be a cowboy at some point in my life, but yes, I don't ride horses anymore. That's for my wife to do.
Well, your wife is a smart woman. They say as a horse girl, it's always a good idea to marry a farrier, and she's got a vet and a farrier, so
Yeah.
double double points. What is one myth about laminitis you wish would disappear forever?
Oh.
He's got 7 of them, he says.
The one I think that is probably, most difficult to kind of deal with. I think a lot of people really still struggle with the concept that the deep digital flexor tendon, the tendon that runs down the back of the leg and inserts on the back of the pedal bone, its role within laminitis. And, you know, unfortunately, for many years, we had one professor that was like, the deep digital flexor tendon has nothing to do with laminitis. But if we think about how the lower limb functions, you need to have a structural hoof wall. You need to have a lamellar attachment that attaches the wall to the bone, and a deep digital flexor tendon that stores energy. That's part of locomotion. If we can't load the deep digital flexor tendon, the horse doesn't move forward. So if all those three things are interacting together along with the ground surface, everything's working okay. If the horse develops laminitis, we get breakdown of that attachment. So what happens? The hoof wall, when it hits the ground, starts to go this way, while the deep digital flexor tendon starts to pull this way. And when they're in equilibrium and they're working together, they stay together. But once that lamellar attachment breaks down, all of a sudden we get this. And so I think that's probably one of the biggest myths and the things that people miss. And it really significantly impacts the long-term rehabilitation of those cases. Because once you understand the role of the deep digital flexor tendon, it's not the whole thing, but then we can set up a shoeing package to help that horse long-term and get them out the other side. And so for me, that's probably the biggest one that I deal with a lot of the times. And obviously with the internet and social media, everyone's got an opinion and they're all experts now, which we all have to deal with. But, I think if you can get your head around that and how we can manipulate the deep digital flexor tendon through different types of shoes and providing heel elevation, reducing the path that the deep digital flexor tendon has to move through, we can actually really get some significant rehabilitation for these cases.
Okay. And just because people can't see you when you were doing your hands,
Oh,
when Luke
yeah,
said
sorry.
the hoof wall goes this way and the pedal bone goes that way, the hoof wall was going up, the pedal bone was going down, and they were separating because they're the pull of the of that tendon. Yeah. Okay. It makes perfect sense to me.
Yeah.
So if
I don't understand why some people, particularly some very smart individuals, couldn't quite get their head around that. They have now kind of gone, yeah, okay, maybe it does play a bit of a role. But, like we talked about, different conformations, even within one horse, will develop different forms of laminitis based on their lower limb conformation. So,
Yep, no, it all makes perfect sense. If you could ride any horse, past or present, which horse would it be?
Ride one.
Pat one, lead one, see one. You choose. He goes, I don't really ever want to ride a horse again.
Like, if I could ride, it would be really cool to be able to ride our stallion, Sicario. I think that would be like an amazing experience. But yeah, ain't no way you're going to catch me up there.
Dressage horse, Luke?
Yeah. I'm also like partly afraid of heights. So like, yeah, it's just not happening,
Yeah, wow. Okay.
Yeah.
Good answer. He'd rather stay on the ground. I have Barbaro in my head because I'm like, oh, if only we could have fixed him, he would have been cool to ride. But if hooves could talk, what would most horses' hooves be complaining about?
In general, I really think, we're seeing it a little bit, these things kind of go in waves, I reckon. We're seeing a little bit less of it now. But I think overdressing and over trimming hooves, significantly impacts them, hoof health wise. And so, there's always this sort of pressure from owners or whoever that you have to trim lots of hoof off. There needs to be a big pile there. You have to rasp the entire hoof wall so it looks completely clean. But actually that doesn't help the horse long term. And, we see it pretty frequently in winter when the hooves get really wet and the wall looks a little bit shabby, and, you pull the shoe off and you just take the rasp and you trim, you sort of rasp the walls off and make it look pretty. And it looks good for a few days, but then you come back the next cycle, it looks worse because every time you hit that rasp on that outer hoof wall, the hoof walls are tubular, so you can imagine it's a straw, and the straw is coming out of the coronary band and coming down to the ground surface, and you take that rasp and you just keep opening up that straw. You're opening it up down the length of it, and that weakens the tubules, which makes them more unhealthy, makes it difficult to hold shoes and those sorts of things. So over trimming and over dressing horses' feet, I think a lot of horses would be like, hey, just take it down a notch.
Leave my hoof walls alone. So over time, they would get quite thin, wouldn't they? If you're just constantly rasping off the top of the hoof wall.
Particularly if you start at the coronary band and dress the whole foot down. Yes.
Okay. And when you say dress, like to me, I'm thinking putting oils and stuff on, but no, you mean
rasping,
like rasping it.
You start your rasp at the coronary band and you go all the way to the ground surface. For me, rasping the bottom third lightly, around where all the old nail holes, one makes the hoof look a little bit nicer, but then, it's not deteriorating the whole hoof capsule, like the further up you start, the longer it takes for it to grow down. So.
And my favourite question of every interview I do, if you had 2 minutes with every horse owner in the world, what would you tell them?
What would I tell them? I think spend money on learning how to ride your horse. I think that is the best piece of advice that I could give people, especially now where we're using horses for enjoyment, not for a job. So if you enjoy riding horses, become the best horse rider that you can be, because that's going to save you a lot of heartache and a lot of issues later on down the track. Like, whether it's a lameness that could have been prevented, whether it's, you're not riding your horse and it develops insulin dysregulation and it gets laminitis, it just has so many flow-on effects. So if you have a budget and, toss out all the kooky stuff that's in your feed room and, think, talk to Nerida and make a plan for your horse's diet, but learn how to ride your horse. And that's going to save you a lot of time and a lot of money in the future. And it's going to really help you out. And you're going to enjoy owning a horse, because if you don't learn how to ride, and this is coming from me who just said, I'm not going to learn to ride my stallion, but at the same time, it's like, if you spend money, find a coach, go there regularly, commit time, you will become a better rider, you will become a better horse person, and you'll enjoy the whole experience way more than if you're spending all this money on all this other stuff and you're trying to get this and the next gadget and that's going to make my life better. No, think about how you're interacting with the horse and learn to ride, get fit, and just start being part of that horse's life and be consistent with them. And so that's, outside of all the knowledge that I know about laminitis and horses' feet and lameness and all the rest of it, the thing that I see the most is, and because I do a lot of telehealth and I watch a lot of people ride, I think if you really hone your skill as being a rider, a lot of the other stuff goes away. Because you're riding correctly, the horse feels better, it has confidence in you, doesn't feel lame, it doesn't develop a lameness, it stays fit, it stays healthy. All of these things are huge flow-on effects.
I love that, Luke. And it's, I'm not a brilliant rider. I ride, but I do see, people in your profession talking about the negative impact of the way people ride on the horse. So I think, it's beautiful advice. Go out and enjoy your horse, but do it in the best possible way you can. Thank you for being who you are, and thank you for doing what you do for all of the horses that you interact with. And thank you so much for your time today and coming on and being one of our podcast guests. It's been a lot of fun, Luke.
No worries. Great to be here. It was a lot of fun.
And I'm off to check the fat pads over my horse's eyes.
You better.
Amazing. Thank you, Link. If you'd like to know more about the My Happy Horse Nutrition app and how it can help you create personalised nutrition for your horse, grab the download link straight from the show notes or head over to myhappy.horse. And while you're there, check out Dr. Nerida AI. That's me in AI format, ready to answer your horse nutrition questions even in the middle of the night. Thank you for being here, and I will catch you in the next episode.